So hey guys, welcome once again to my channel. It's conceptual. So today we're gonna talk about the anti-helminthic drugs. Okay. So helminths contains of two class, that is nematodes and the platyhelminthes. Okay. So these are the antiparasitic antibiotics that treat infections by parasitic worms or helminths. Okay. So basically there are of two types: vermifuges, that is stun helminths or stop the helminths to grow, and vermicides, that is they kill the helminths. The helminths is used for many multicellular worm like parasites that can infect the human. So basically there are a class of parasites that infect the humans. Okay, and this consists of cystodes, trematodes and nematodes. So हमने I guess the CBSE and both the बोर्ड्स या जो भी बोर्ड से आप हो तो आपको पता होगा कि एनिमल किंगडम करके एक क्लासिफिकेशन होता था, एंड यू नो क्लासिफिकेशन थे. कौन कौन से क्लासिफिकेशन थे? जस्ट लेट मी नो इन द कमेंट सेक्शन बिलो, एंड विच इज़ द लेटेस्ट क्लासिफिकेशन, दैट इज 6 क्लास क्लासिफिकेशन. So just let me know in the comment sections below. Okay, so now moving on, the first we'll study about the normal pathogenicity of the cystode, nematodes and trematodes, and then we'll move on to the drugs mechanism actions and its side effects. Okay, so cystode are basically they are 7 meter long. Okay, इतने बड़े होते हैं, just like 7 meter और ठीक है 13 feet around होते हैं वो. Okay, so they are so much big, and they can lay around 50,000 eggs during a complete life cycle. So अगर आप infected है, so basically they are not alone, they will grow in mass. Okay, so वो कहाँ से आते हैं? So the carriers of this are the tinea, they are tinea saginata and tinea solium, and the carriers are basically cow and pig respectively. Okay, so अगर आप uncooked या फिर undercooked बीफ या फिर अंडा को पोक खाते हैं, तो दिस दिस सिस्टोड में एंटर अवर small intestines. Okay, so and they live off nutrient rich fluids. Okay, so जो न्यूट्रिएंट होते हैं, जो फ्लूइड्स होते हैं, उससे वो अपनी लाइफ साइकिल कंप्लीट करते हैं. ओके, एंड दे आर ऑल्सो hermaphrodites. So hermaphrodites are those that lay the eggs. Okay, so they lay eggs in the very large quantity. Okay, so via this they cause teniasis, that is it is asymptomatic, and it can cause GI symptoms such as abdominal pain, nausea, diarrhea and weight loss. And the other disease that is caused, that is cystic sarcosis. Okay, that is newly attached larva burrow into different parts. Okay, सो सिस्टिक साइक्रोसिस अगर ब्रेन में है, अगर इफेक्ट करा, that will cause the neurocystic psychosis. And okay, and the eggs of tinea solium can also be ingested via contaminated feces, or they can ingest into our digestive system and cause the various GI symptoms. Okay, and in serious conditions it may cause seizures, blindness, and basically it may be fatal and lead to death. Okay, so cystodes are mainly also known as the tapeworms. Okay, they are also known as the tapeworms, and they are hermaphrodites, and the carriers are cow and pig. Okay, so now moving on towards the trematodes. Okay, so this their main carrier is basically freshwater snails. Okay, and they are also known as flukes. Okay, so basically there are two kinds of flukes, that is liver flukes. Okay, that is Chloronorchis opisthochis, and the blood cystoma, that is the blood fluke, and the Chloronorchis is the liver fluke. Okay, so the blood fluke causes cystomosiasis, that is also known as the snail fever. Okay, and basically वो कैसे होता है इफेक्ट कि fresh swimming larva get attached to the freshwater snails and penetrate through the hair follicles to capillary beds or feed on the blood. So basically अगर हम freshwater lakes में या फिर कहीं पे कैनाल में स्विम कर रहे हैं कुछ लोग, तो they can enter via the hair follicles and enter via capillary beds or directly into the blood. Okay, and अदर देन दैट द अल्टरनेट पाथवे इज कि फ्रेश वाटर स्नेल को फिश खा जाए. ओके, द फ्री स्विमिंग लार्वा has the snail has the free swimming larva and it is consumed by fish, and this fish is ultimately consumed by the human. So this is the cycle. Okay, and so burrows through the intestinal wall to the liver and bile duct and feed on the bile. So once ingested, they go through the intestinal wall and go to the liver and bile duct and feed on the bile. So mainly basically they feed on the bile. Okay, so this both liver flukes and blood flukes are basically the main carrier is the snail, and via swimming they can enter directly to the humans, or via fish they can then enter to the humans. Okay, so I hope you understood this. That is, पहले तो हमने tapeworms पढ़ा, that is cystodes, and now we are studying the flukes, all trematodes. The next class is the nematodes, or also known as the roundworms. Okay, so cystodes is tapeworms, the trematodes is the flukes, and the nematodes are the roundworms. So nematode eggs can be ingested via this contaminated species. Okay, and the steps are as follows. That is, the hatch into the larva and cause the GI symptoms such as malabsorption, diarrhea, and abdominal pain. And most common species is ascarias. That will cause the ascariasis. Okay, they bore through the gut to bloodstream, then to the lungs. So they bore matlab they transfer to the gut, they transfer through gut to bloodstream and lungs. Okay, so gut के वाया वो अलग अलग बॉडी के जगह माइग्रेट करेंगे. ओके, सो दे आर कर्व्ड अप इनटू द ओरल कैविटी एंड swallowed. Okay, and mature into the adult worms in the intestines. Severe infections, they cause severe infections, that is, in chronic stages they can also cause the complete obstructions of the intestines. Okay, so basically वो intestines को affect करेंगे, and they are mainly consumed by the contaminated fishes or the contaminated products. Okay, and first they affect the intestine and cause GI symptoms, and in chronic stages they can also cause the complete obstructions of the intestines. Okay, so nematodes, the other examples as enterobius, that is they are also known as the pinworms. Okay, तो ये थे जो nematodes थे वो round worms है. Okay, and the other as the pinworms that hatch in the small intestine and live in the colon. The next are the webworms that hatch in the small intestine and burrow into the intestinal mucosa. Okay, so basically pinworms क्या करेंगे कि they lay eggs in nearby skin folds. Okay, during midnight they come out of the cavity and they lay eggs in the nearby skin fold and cause severe anal itching. Okay, and so they are caused, कैसे वो अंदर एंटर में बॉडी हो गए, if we are walking barefoot in on the contaminated places containing the nematodes, then this can enter and attach to the intestine, and then they can lay eggs in the skin folds of the anal canal. Okay, causing severe anal itching. So this is all about the pinworms. The whipworms are, they burrow in the intestinal mucosa. The nectar Americans, hookworms, and strongylocytes tuberculosis, that is threadworms, hatch in soil and contaminated with feces with their eggs. So these are also this organisms. Okay, कि hookworms and threadworms also are basically the same. कि अगर आप चलते हो contaminated जगह पे, then they will also cause the same type of infection. Okay, so pinworms, hookworms, threadworms, whipworms, and the roundworms, this all are the nematodes. Okay, and the next class is that filarial worms that need an insect as an intermediate host. So the black flies and the mosquitoes. The black fly is the carrier of the loa that invades the skin and eye. Okay, and the mosquitoes are for the Wucheria bancrofti, which invades the lymphatic vessels and cause the elephantiasis. Okay, so basically this all are the class, that is nematodes, trematodes, and the cystodes. Okay, so I hope आपको ये pathogenicity समझ में आ गई होगी. So now moving on, that is anti-helmintics. There are two classes in this. Okay, that is the anti-nematodal and the anti-platyhelminthes that treats the flukes and tapeworms. Okay, and anti-nematodal हमने अभी देखा कि nematodes को हम inhibit करेंगे. ठीक है, so platyhelminths has a one drug, that is the praziquantel. Okay, so it is the first line of therapy versus most tapeworms and flukes. It is well absorbed in GI tract, increased membrane permeability of calcium ions in the पैरासाइट. ओके, सो एक बार कैल्शियम आयन अंदर घुसते ही हमको पता है कि वो अपनी चैनल्स खोल लेता है एंड कॉज द contraction. Okay, but excessive ion permeability that will cause the muscle paralysis and ultimately lead to the death of the parasite. It is metabolized by cytochrome P450, so inducers of the enzyme can decrease the effectiveness. Okay, so limited effectiveness because of metabolism by cytochrome P450 versus the सर्कोसिस. ओके, सो न्यूरोसिस्टिस सर्कोसिस मैंने आपको बताया था कि अगर ब्रेन में हमारे वर्म्स चले जा रहे टेप वर्म्स, तो दैट विल कॉज द न्यूरोसिस्टिक साइक्रोसिस. सो इट इज लिमिटेड इफेक्टिव अगेंस्ट दैट, सो इट इज द सेकेंड लाइन ऑफ ट्रीटमेंट. फॉर ऑक्यूलर सिस्टिक सर्कोसिस इट इज कॉन्ट्राइंडिकेटेड बिकॉज द डेड वर्म्स में मतलब रह जाएंगे आई में एंड दे कैन कॉज द परमानेंट आई डैमेज. सो सर्जिकल रिमूवल इज द बेस्ट ट्रीटमेंट फॉर द ocular cystic sarcosis. Okay, the side effects are very mild and they can cause headaches and the fatigue. Okay, so praziquantel is the first line of therapy versus most of the tapeworms, and it has limited effective against neurocystic psychosis and ocular cystic psychosis में हमको नहीं देना है, हमको ये याद रखना है because it can cause the permanent blindness. Okay, moving on towards the next, that is anti-nematodal. Okay, so anti-nematodal में the first example is the benzimidazole. The example is the albendazole and mebendazole. Okay, so they inhibit the formation of the microtubules from the cytoskeleton. So cytoskeleton को ही उसका जो बेस है उसको ही ये फॉर्म होने से इनहिबिट कर रहा है. सो दैट विल कॉज द डेथ ऑफ द पैरासाइट. Okay, so albendazole is used against the Ascariasis, pinworms, hookworms, and the whipworms. Okay, and is the first line of therapy for the neurocysticercosis. So albendazole हम याद रखेंगे, and second line of treatment अब भी हमने पढ़ा, that is the praziquantel. Okay, the side effects are they are teratogenic, so they are contraindicated in the pregnancy, causes bone marrow suppression and liver toxicity. So this is all about the benzimidazole. और याद रख सकते हैं हम एग्जाम्पल, दैट इज एल्बेंडाजोल. ओके, सो नाउ pyrantel pamoate. So it is poorly absorbed and it is given perorally. Okay, and only affects nematodes on the GI tract. So GI tract में जो भी infect causing organisms है उसके against ये काम करेंगे. Okay, it stimulates the muscles nicotinic receptors. Okay, so they stimulate the muscle nicotinic receptors and cause uncontrolled muscle contractions. Okay, so muscle contractions वो because of the acetylcholine release, the uncontrolled muscle contraction takes place and that allows the paralysis. Okay, so paralysis हो जाएगा, so expulsion of stools takes place. So GI tracts में अगर हमारा obstruction हो गया है तो उसकी वजह से वो paralysis करके पूरा stool के साथ वो कंटामिनेटेड जो भी कंटेंट है वो बाहर निकल जाएगा. सो दैट्स गुड. ओके, सो ऑब्स्ट्रक्शन एक तो मिट जाएगा एंड द होल पाथवे ऑफ द जीआई विल बी क्लीन. ओके, एंड इट इज़ अल्टरनेटिव टू बेंडाजोल्स. ओके, मतलब एल्बेंडाजोल के वो अल्टरनेटिव है. सो दे डज नॉट अफेक्ट द विपवर्म्स एंड द टेपवर्म्स बिकॉज विपवर्म्स एंड टेपवर्म्स आर बेसिकली आर माइग्रेटिंग फ्रॉम जीआई. ओके, तो वो जीआई ट्रैक से माइग्रेट कर जाएंगे तब वो किसी काम के नहीं रहेंगे. अगर वो इंटेस्टाइन्स में इंटैक्ट है या फिर इंटेस्टाइन में ऑब्स्ट्रक्टेड है, देन ओनली दिस क्लास इज यूजफुल बिकॉज दे ओनली affect the nematodes in the GI tract. So the side effects are mild and they cause sometimes headaches and the GI symptoms. Okay, so anti-nematodal में हमने दो पढ़े, that is Pyrantel pamoate and the benzimidazole class. Okay, that is हम क्लास नहीं याद रखो तो भी albendazole और mebendazole याद रख सकते हैं. Okay, the next drug is the Ivermectin. So Ivermectin interfere with the nervous system of the invertebrates. It binds to the glutamate gated chloride channels. Okay, so basically क्या होगा कि क्लोराइड चैनल्स के साथ वो बाइंड कर जाएगा. ओके, सो क्लोरीन का क्या बोलेंगे, क्लोराइड के चैनल के साथ बाइंड हो जाएगा तो चैनल्स खुल ही नहीं पाएगी. ओके, सो एक बार चैनल्स खुल नहीं पाएगी तो दे go in the state of the hyperpolarization. एंड एक बार चैनल क्लोरीन चैनल्स आयन खुल गई तो वो नहीं कर पाएगा। ओके, सॉरी, आई विल करेक्ट माई सेल्फ कि क्लोरीन आयन चैनल्स हाइपरपोलराइजेशन स्टेट में क्लोज नहीं होंगे। जब ओपन होंगे तब जो नेगेटिव आयन्स अंदर की तरफ आएंगे, बिकॉज इट हैज कंटेन अ पॉजिटिव चार्ज, बिकॉज सोडियम का इंटेक्ट हो गया था। सो क्लोरीन आयन्स जब अंदर आएंगे तब वो क्या करेंगे कि ग्लूटामेट ग्रेडेड क्लोराइड चैनल के साथ वो बाइंड कर जाएंगे, एंड दैट विल नॉट कॉज द क्लोजर ऑफ द क्लोरीन आयन चैनल्स। सो द क्लोरीन आयन चैनल्स विल बी कंटिन्यूसली परफ्यूज्ड इन द नर्वस सिस्टम, या बोल सकते हैं न्यूरॉन्स एंड द मसल फाइबर्स रिस्पेक्टिवली। ओके, सो क्या होगा कि क्लोरीन आयंस अंदर जा तो रहा है पर बाहर नहीं आ पा रहे। ओके, मतलब उनका क्वांटिटी मसल के अंदर बढ़ता ही चला जाएगा। ओके, सो दिस स्टेट ऑफ इंक्रीज्ड क्लोराइन आयंस इन द मसल्स that will cause the hyperpolarization in the neurons and the muscles. Okay, so एक बार hyperpolarize हो गए तो they can't contract, and once they can't contract they will lead to paralysis and they will ultimately die. Okay, so this is the medication of choice versus the threadworms, and also used as a second line medication for the ascaris and the hookworm. So ivermectin is the first line of treatment for the threadworms, and second line of medication of the ascariasis and the hookworms. Okay, so side effects are headache, dizziness, muscle pain, nausea and diarrhea. So एंटी निमेटोडल में हमने आइवरमेक्टिन देखा, बेंजीमेडॉल, कौन सा, बेंज एल्बेंडाजोल एंड मेबेंडाजोल, बेंजमेडाजोल क्लास, एंड पायरेंटल, पाइमेवाइट एंड द आइवरमेक्टिन, एंड इन द प्लेटिहेल्मिंथिस वी सॉ द प्रेज़िक्वेंटिल। गाइज ये थोड़ा सा याद रखने की कोशिश करिए, बिकॉज आई नो इट्स थोड़ा सा लेंथी एंड इट्स मोर ऑफ याद रखने वाली चीज़ है, बट यू हैव टू मेमोराइज इट। ओके, सो नाउ आई इन द लास्ट आई विल गिव यू अ फन mnemonic. Okay, so moving on towards the next, that is the diethyl carbamazine. It is also antinematodal and used for the treatment of choice for the Wucheria bancrofti and the loa filarial worms. Okay, and it changes the cell membrane. The mechanism of is still unknown. Okay, so it is easier for the immune system to target and remove. Okay, so changes the potentiality of the cell membrane and makes it easy for the immune system to target and to kill it. Okay, the side effects are mainly itching, facial swelling, headaches and the vision loss. Okay, so now I'll just let you a fun mnemonic to may remember it. So here's a farm statue. Basically the farm is divided into a garden and a farm. Okay, so एक पूरी लाइन है. ओके, सो द टेपवर्म्स एंड फ्लूक्स के लिए अलग से ही हमने बना रखा है, एंड फॉर ऑल द नेमेटोड्स दिस इज द अदर क्लास. सो हियर इज farm statue that represents the Ascariasis. It has pin in it, that is the pinworms, and it has got a web that represents the webworms. Okay, so the next is there is a thread and a fishing hook that represents the threadworms and the hookworms. Okay, and here is the swelled elephant of Wucheria bancrofti that shows the elephantiasis, and a girl dancing loa, that is representing the loa. Okay, so the class is used to treat, that is the the lady that is bending very much, that represents the bendazoles. Okay, and she has a brain in her hand for using, that is drug of choice or first line of treatment of the neurocystic sarcosis, and it is between the statue and the hookworms and threadworms, because it is used in the both, that is hookworms and threadworms, and also in pinworm, whipworms and ascariasis. Okay, so here is a mammoth representing the class Ivermectin. Okay, and it is effective against the threadworms and also used for the hookworms and the pinworms. Okay, the side effect of various are muscle pain of ivermectin, and bendazoles are also teratogenic and causes bone marrow suppression and liver toxicity. So these are the some of the side effects. So here carpenter, that is representing the diethyl carbamazine, is cutting the loa and Wucheria bancrofti because it is a drug of choice for them. Okay, and as for the side effect, it causes the vision loss and headache. Okay, So moving on towards the next set for the beef and pork tapeworms. Okay, so the drug of choice for them for the liver fluke and blood fluke is the praziquantel. That is the these are the platyhelminthes, and the praziquantel is the anti-platyhelminthic drug. And here he is standing with the eye board not contraindicated in the ocular neurocytosis because it can cause the damage and cause the permanent blindness. So it is contraindicated, okay, or not used. Simple. So, for a quick recap, antihelminthics are treatment for used for the treatment for the parasitic worms, that is helminths. Antiplatyhelminthic में हमने देखा, that is praziquantel, and anti-nematodal में the bendazoles and the pyrantel, pamoate and the diethyl carbamazine. So these are three drugs in the anti-nematodal, and anti-platyhelminthic has the praziquantel. Okay. So now this is the mnemonic, the anti-helminthic, the anti-platyhelminthic and the anti-nematodal. Here we saw the praziquantel not used in the ocular neurocytosis, the blood fluke and the liver fluke, okay, the pork and beef tapeworms, okay. Now moving on to the anti-nematodal, that is the benzodazole, the bendazoles and the paramyl pamquate, okay. These two are the drugs. That the next is the ivermectin and diethyl carbamazine, okay. The side effects of our bendazoles are the liver toxicity, bone marrow suppression and the teratogenic, and diethyl carbamazine in ivermectin that is causing the muscle pain, and in diethyl carbamazine the headache and the vision loss, okay. The parasites that are indicated, that is Ascariasis, pinworms, hookworms, threadworms, okay, and the whipworms, okay. And the diethyl carbamazine is indicated against the loa and the Wucheria bancrofti that causes the elephantiasis, okay. So these are all the classes, and here are the answers of all the माइंड मैप, ओके. सो आई होप आपको ये पूरा गाइस वीडियो समझ में आया होगा. अगर नहीं आया हो, एंड इफ़ यू हैव सम सजेशंस टू इम्प्रूव माय चैनल, कैसे मैं इम्प्रूव करूँ, कैसे मैं इम्प्रोवाइज़ करूँ, सो प्लीज़ जस्ट लेट मी नो इन द कमेंट सेक्शन बिलो, बिकॉज एवरी टाइम यू नो like, share or subscribe, this gives me a lot of motivation. So please do guys like, share and subscribe, तो मुझे मोटिवेशन मिलता रहे कि मैं वीडियोस बनाऊं. एंड गाइज लेट मी नो कि रोज़ वीडियो बनाना ही ये अच्छा है, या फिर एवरी 3 डे या एवरी 5 डे आई शुड मेक अ वीडियो, बिकॉज आई डोंट वांट कि लोग बोर हो जाए बार बार वीडियो से. सो जस्ट लेट मी नो, एंड लेट मी ऑल्सो नो कि आई शुड स्टार्ट व्लॉगिंग और नॉट. So just let me know in the comment section guys below. So until then, stay safe, stay happy, and I'll see you soon. Thank you.